Thank you very much. Thank you for having me. It is a great pleasure and honor to be here in Malaysia. In the next 30 minutes or so, I will talk to you about the importance of sleep, and hopefully I can give you some clear message about its vital role. Nothing to disclose. This is an overview of the topic that I will go, this is an overview of the topics I will go over today. I'm not going to read this slide, but I want to focus on the scientific background of the importance of sleep, and I will hand the baton to my colleague, Julius. Now, we spend 1/3 of our life asleep, and it was Matthew Walker from UC Berkeley who said once that if sleep doesn't serve an absolutely vital function, then it is the biggest mistake the evolution or creation process has ever made. I hopefully will convince you today that no, sleep is not a mistake. It is one of the most important processes we go through for long life and health. In this slide, it shows the risk of cardiovascular events, especially death related to cardiovascular, whether heart attacks or strokes. And the researcher here followed a lot of patients over time, and they plotted the numbers of hours of sleep. If you look here with me, the nadir, the lowest chance for event is around 7 hours, which will have implication that we'll discuss later. Now, the more people spend sleep has bad effect. So people who slept more than 9 hours, probably from illness or something else, had also worse outcome. But also, certainly, people who slept 5 hours or less have certainly higher incidence of cardiovascular events. If we take the same idea and flip this, who are people who are likely to live the longest? On the x-axis, you will see the hours of sleep. And again, it shows around 7 hours at this sweet spot. Contrary to what we told our patients or the public in the past, it is not the 8 or 8.5 hours. Officially, still, anything between 6 and 9 hours, but the sweet spot appears to be around the 7-hour mark. People, 7 hours of average 7 hours nightly sleep have lived the longest between all their group. Now, in this study that support what I just said, it shows also that both long sleep and short sleep have been associated with increased all-causes mortality, whether it's cardiovascular or non-cardiovascular, but certainly the short sleep was worse in terms of adverse outcome. This is normal sleep structure, so this is how people sleep. Now, a newborn born in a few weeks old will sleep most of her day. They spend about 22 hours. They just wake up here to nurse, probably breast milk or bottle milk, and go back to sleep, and maybe a diaper change in between. But they spend all of their time sleep. 1-year-old get night sleep and 2 naps. 4 years old gets about 1 nap here. And by 10 years old, we have 1 solid sleep, little bit longer than adult life. So people in their teenage year will require 9, 10 hours, and sometimes 11 hours of sleep, depending on their age. But hopefully by the adult time, we are obtaining, like we're getting sleep somewhere here between 11 p.m. to 7 a.m., around average 8 hours or 7.5 hours of sleep every night. Now, using the EEG, the electroencephalogram, we can actually map sleep. Sleep is not a light switch on and off. When we sleep, we go through different stages, and we have it here, N1, N2, N3. And N3 is the deep resting restorative stage of sleep. Now, as you can see here, we go through this cycle about 4 to 5 times every night. Now, each cycle has a different shape. the first few cycles have more of the deep sleep and less of the REM sleep. And the late cycles in the night have more of the REM, the dreaming stage of sleep. And each one serves vital function. This slow sleep is very important in refreshing our mind, but the REM sleep is also important in consolidating our memories, especially for those at the learning age, students, college students, who are trying to consolidate their sleep memory. Now, just remember this architecture because I will refer to it later. Sleep also has vital function because if you ignore the red line for now, look at the blue line. This is an invasive monitoring of blood pressure, systolic and diastolic, done overnight. And this is called dipping phenomenon, which is a normal phenomenon during which the blood pressure will drop by the end of the night. So most of us will wake up with the lowest blood pressure of the day. Now, contrast this to the red line. This red line is someone with disturbed sleep. Here in this example, it's sleep apnea. And you can see that this dip-in phenomenon have disappeared, and that's why a sleep apnea patient will have higher risk for hypertension. Now, obstructive sleep apnea is common and independent risk factor of atrial fibrillation. Atrial fibrillation is the irregular heartbeats that can happen to some people. In this study, they took people with hypertrophic cardiomyopathy, just enlarged heart, who have higher risk for sleep apnea, and compared between those who have sleep apnea and do not have sleep apnea. And look, only 3 out of the 48 people who don't have sleep apnea developed these irregular heartbeats, but about 1/3 of the 32 people who have obstructive sleep apnea and at the same time enlarged heart developed atrial fibrillation, which is these irregular heartbeats that can make people feel bad, but also can develop blood clots that can travel to the brain and cause stroke. So what is it about sleep, poor sleep, that affect life expectancy? Well, when you're sleepy, you're more likely to get accident, whether it's car accident or industrial accidents or any other accidents. Of course, there is higher risk for sudden death, and we'll talk about all of this briefly in the next few minutes. Now, obstructive sleep apnea is a very common condition that can affect the quality of sleep. So even if you sleep long hours, good hours, but if the quality of sleep is not good, and it is common, and it increases with age, but also is linked to all of these conditions: high blood pressure, heart disease, strokes, and also increased risk for insulin resistance and probably obesity that my colleague, Dr. Julius Gao, will talk about later today. So what is it? What is obstructive sleep apnea? Well, it's the way we breathe is we have the diaphragm, the dome-shaped muscle that contracts down. So we actually generate negative pressure in our chest. Technically, we actually suck air into our chest. And in some people who have a relaxable airway, when they are trying to go from the shallow stage of sleep to the deeper stage of sleep, the airway can collapse and can cause this sound, strange sound, known as snoring. So you hear snoring. That's not bad. It's when the snoring progresses to do something like, and usually 3 breaths, and the people kind of wake up and doing this sound after they have been snoring or stopped breathing. This also coincides with sending alarming signal in the brain that gives a surge of adrenaline that keeps blood pressure up and blood sugar up, and hence it is causing changes. Also, the cyclic level of oxygen, when the oxygen level goes up and down, that also can affect the hormones of the body and can affect the inflammation and lead to many other conditions. The pressure inside the thorax can be different also when we are trying to suck air against a closed airway. It can affect the cardiac output, how efficient the heart can pump blood. And also the result in microarousal, like when people go into the earlier stage of sleep and do not go into deep resting stage of sleep, they will become sleepy during the day, and also they will have trouble concentrating and focusing. Now, this is a recommended source because sleep medicine is an ever-changing. This article was published as a result of task force. This is my colleague who works at UCSF, but he happened to be one of the authors, of many authors in the, for the article, that goes also in details through what is learned recently about sleep. What we know now that home sleep testing is adequate. So home sleep testing now is as good for most of the time, which is also very nice. It is not all about AHI. AHI is apnea-hypopnea index, which is the way we can quantify sleep disturbance. Also, there is still big disparities between rich and people who have access to healthcare and other countries, and I really here commend AmLife for participating in closing these disparities. Lack of good sleep also, lack of good randomly trials, so we don't have a good trials to really look at the result of treating sleep apnea, for example. And some people also are more likely to benefit from treatment based on this article. Anyone who is sleepy or have oxygen level low or high blood pressure are more likely to benefit from treating their sleep apnea. This is another reiteration of how this happens, so that change in oxygen or the dysfunction can lead into change in inflammation, which also will result in the cardiovascular diseases that we already talked about, whether it's coronary artery disease, which is the disease of heart attack, or the stroke, or pulmonary hypertension, or high blood pressure, or atrial fibrillation, irregular heartbeats. Now, without doing sleep study, how do you suspect? Someone may ask, well, how do I have sleep apnea? How can I tell? How do I know that I need to seek medical help? Well, if you have excessive daytime sleepiness, headaches that wakes you up from sleep, memory impairment that is not associated with aging, and especially if you have irritable mode, you feel like very irritable, difficulty focusing, concentrating. Nocturia is the urge to go to the bathroom at night, which is always not normal, and also decreased libido or erectile dysfunction. All of this will make us suspect sleep apnea. Now, exam findings like obesity, especially truncal obesity and neck or crowded airway, and I will let my colleague explain about crowded airway because this is his specialty. Now, this study was also told us that sleep is not about feeling good or matter of convenience. It's also about life and death. In this study, they took the time of death over one center over many years, and they divided the time between nighttime, early morning to early afternoon, and afternoon, so 8 hours each. Let's look at the blue columns. It turned out that most people who do not have sleep apnea will have, if they will have heart attack or sudden death, it's going to be between 6 a.m. when they wake up to 2 p.m. That's well known in general population. Now, look at also the time of sleep. So dying during sleep is very unusual. It's actually less likely in people who don't have sleep apnea. It's like only 24%, less than 1/4 of this population. Contrast this to the red column. The people who have sleep apnea are actually more likely to die, like double the death in their sleep, and less likely to die during the waking hours. That started to give us a hint in 2005 that, okay, there is something about sleep apnea that increases risk of death. Now, another researcher looked at also the circadian pattern. When does this defibrillator fire off? For those of you who don't know, the defibrillator is an implantable device for people who have serious heart arrhythmia. The good news about this device that you can actually access the device and interrogate it. So you can tell exactly how many times it went off, it fired, and how many, and what was the time. So this group looked at two groups of people who have no sleep apnea in the left side, or a very mild sleep apnea that can be ignored with AHI less than 10, or severe sleep apnea, AHI more than 10. And look, they looked between sleeping hours, midnight until 6 a.m., or the rest of the hours, the other 18 hours. So there was no difference, no statistical difference between when this defibrillator fired off in people who don't have sleep apnea. Contrast that to the two columns in the right side. When people have sleep apnea, this defibrillator, this device that gives you technically an electric shock to save your life, is way more likely to fire, and this is very clear in this, this graph. This also further solidifies the science that sleep apnea or poor sleep is associated with more than. Now, these people luckily didn't die, and we don't want anyone to die, but this device doesn't go off for no reason. I mean, when the defibrillator fires off, it's usually for a very good reason. Now, let's switch gear to stroke, because it's also important. So untreated sleep apnea is very well-known risk factor for stroke, which may be related also to irregular heartbeats, as we talked, because it can cause more blood clots in the heart, but also maybe related to inflammation. And the link is very clear in the longitudinal studies. In this study that was done at Yale and published by Dr. Yagi, he looked at the Kaplan-Meier curve, which is like following people over years. Here in this example, 6 years. And he compared between control and patient with sleep apnea. And this is the survival. And you can tell that the control survived better than patient with sleep apnea. And he only did it for 6 years. You can see that the two curves are diverging from each other. So had he continued for 10 years or 15 years, you will see these two curves going away from each other. He also showed in another curve that I don't have here that there is a dose effect. In other words, the more severe the sleep apnea, the more disturbed the sleep, the higher the risk for stroke. So this was also another piece of the puzzle. Now, let's switch gear to a very new and exciting science about dementia, because for many, many years, we didn't have much about dementia. It was like a disease of elderly. You diagnose it, you don't know what causes it, and there is not much to do about. Luckily, nowadays, we have more science to present and actually to work on. So we know that dementia is common, and it increases with age. It happens usually to women more than men, slightly. But also, we have some breakthroughs in the science of dementia in the last decade, 10 years or so. So there was a form of waste product, a very sticky protein called beta amyloid that accumulates in the brain, and the buildup of this protein can lead to dementia. And many ongoing studies are working on this beta amyloid to see if we can reverse this study. So now we know that dementia increases with short sleep. Here you have 7 hours, 8 hours in the top two lines, very close to each other. And this is why I tell you like 7 hours may be probably good enough. But also long sleep, when it is more than 9 hours, is actually associated with dementia. This Kaplan-Meier curve is the survival from dementia over time, and this one goes only 5 years. But look at the red line. The red line shows that short sleep or inadequate sleep, and in this example, less than 5 hours in average, is really strongly associated with the development of dementia. Now, we know about dementia and its relationship to sleep, and we know about beta amyloid, but someone could say, well, what if demented people don't sleep well? What is the causality here? Well, this study actually was funded by National Institute of Health, NIH, and Dr. Shukri Kojori have conducted very nicely done study which looked at the beta amyloid in the brain non-invasively. So let me take you back one step. This is Markin Nedergaard. She is a basic scientist who did research on the mice, and she discovered that unlike the rest of the body that has lymphatic system, the brain has its own cleansing system. She called it glymphatic. because from the gliocytes that are in the brain. So technically, the brain gets washed, but unlike the rest of the body, this washing happens only at night during sleep. And especially during the deep sleep, the delta sleep that we talked about, that many people with sleep apnea actually don't reach because they keep getting bounced in and out of the shallow sleep. Now, this led to these researchers to look at through imaging study, PET CTs, like special isotopes, to look at the beta amyloid in the brain. And they took volunteers and asked them to stay awake for 24 hours. And when they actually imaged them after being awake for 24 hours, they found that the accumulation of beta amyloid in their brain have increased. So this is a very clear evidence that this material, beta amyloid, gets accumulated as we are awake, it gets cleared during sleep, and lack of sleep make it stick around for long. So sleep then is believed to flush beta amyloid from the brain, and lack of sleep or lack of good quality sleep is associated with more amyloid. And amyloid is very well known to cause dementia, and better sleep hopefully can prevent the development of dementia. Now, depression is a slightly different story because the sleep disruption and mood dysregulation happens with poor sleep. When you are sleep deprived, you're more likely to have low energy, and a lot of these symptoms can also be associated with the depression. Now, hypoxia also, the repetitive hypoxemia and re-oxygenation can affect brain function. And we know also that when the oxygen goes up and down, the inflammation and hormonal imbalance increases, and the hormonal imbalance will lead to mood dysregulation. Now, this study also looked at the cognitive function of the brain and lack of sleep. Now, there is significant overlap, of course, between depression, anxiety, and obstructive sleep apnea symptoms, but especially the high executive function, the high way of thinking, attention, or calculations, like complicated calculations, get affected first. The most verbal function, like language and others, usually are not affected by this. Now, the most important thing that this is potentially reversible, but if left untreated for a long time, it may not all go away with treatment. So I will spend the last few minutes I have to go over some practical tips to improve our sleep. So first, I will talk about sleep hygiene. And this is a word actually not for cleanliness, it's for sleep habits. We'll talk about also temperature, the value of sleep, like just the attitude towards sleep, and look for and treating sleep apnea, and more drug-free treatment. The first tip is the regular sleep. Our internal clock is not perfect. We all have an internal clock called suprachiasmatic nucleus. It sits in between the optic nerve, the nerves that come from the eye, and usually it fixes our imperfect clock. The light clues can affect this, and especially the bright shortwave light, which is, by the way, similar to the light we're exposed to through these screens. So the screens actually that we stare into can affect our sleep, and that's why many of the new screens now have night vision mode to allow you to sleep better. Now, the thing about this suprachiasmatic nucleus, you cannot fix it right away. It takes about 1 to 2 weeks to get into the rhythm. So you can't force your brain to go to sleep always, but you can force your brain to wake up. So my first advice is to wake up exactly at the same time of the day, whether working or not, weekday or weekend, because that's how you can get your brain back to the rhythm. Now, our core body temperature goes down about 0.5 degrees Celsius during sleep, but also most people who are surveyed will feel better if we drop the room temperature by 2 degrees Celsius or 3 degrees Fahrenheit during sleep. They just tend to have better sleep. Now, we need also to approach sleep with value. We cannot consider sleep a waste of time, as you've probably seen in the commercial. We have to allow ourselves enough time to sleep. So if sleep efficiency reduces with age, so to get the same 7 hours of sleep when you are 80 years old, you may actually have to spend 8.5 or 9 hours to get these hours, 9 hours in bed to get 7 hours of sleep, because sleep efficiency means, well, the time you spend asleep while in bed. Also, definitely sleep is not a waste of time, and look for any sleep disturbances, especially obstructive sleep apnea, and treat it. Now, this is the difference between the traditional in-lab study to the right and the home sleep testing. For most people, home sleep testing is now adequate, and hopefully this will remove a barrier to seeking medical help and testing for sleep apnea. The traditional sleep study, also known as polysomnogram, that requires a lot of wiring and sleeping in the sleep lab, can still be required for certain people. In our practice, where I practice in California and United States, probably 90% of all our sleep testing are done at home. Only 10% of those need to come to the lab. Now, if we happen to find obstructive sleep apnea, how do we treat it? Well, CPAP is still the most reliable and most effective way of treating sleep apnea. Luckily, CPAP machines are getting better. Better meaning smaller, quieter, more energy efficient, and they have also a lot of comfort mode that made them more tolerable. So I always get people who say, oh, I don't want that thing. I say, well, have you tried it? So I usually ask them to try, and with good coaching, actually, in our office, we can get about 89% of all people who need CPAP to use it. That percentage nationwide in the US is about 65%. So 1/3 of patients do not use CPAP, and usually this is when the medical care comes in. Now, it is better to use CPAP. So someone who says, well, you know what, I'm planning to lose weight. I don't want to sleep in my back. I want to lift the head of the bed. I said, well, okay, until you lose weight and go back to your ideal body weight, please use CPAP until then, because this is a matter of life or death. Now, thank you all for having me in beautiful Kuala Lumpur, and I hope you all will have good night's sleep.
Thank you, Dr. Eyad, for giving us tips for a better sleep.